So the Adams tool, I don't know whether that's replicated across the country, is a tool that we use within our local authority, and it allows us to monitor safeguardings and capacity. It allows us to look at training and staffing levels, policies, guidance.
A couple of other information that we had to send because of various initiatives that would happen. Things like the CMA, for example, and the pricing or the finance, the brackets we had to send. There were things like dolls-related surveys used to be conducted as well, and safeguarding.
You sort of get information back from those data sets from local authorities, like things that you could actively use within your care services, or you sort of sending data off into the void, never to be seen again.
Yeah, it's usually unidirectional, and even now I think that's what we hear from some of our clients who are starting to look at data as an asset, and their question, like what you are saying, why are we sending this, and what benefit does it actually give it back to us? And I often, cross towards that thinking. I often say, are you capturing that information for yourself? And what's the lens is, you're not collecting it for them. Is there a business benefit in recording and collecting that information for yourself? And then, find a mechanism of easily sharing or transporting that data back to them.
Worrying because it's now, whether it's there has been a commitment to capacity tracker, and there's also going to be, fines and punishments in place for not completing as well. We know that, so it's definitely stick, not carrot, now for capacity tracker. And it worries me because they've tried. Capacity tracker was initially a tool which was repurposed from occupations for vacancy tool for care homes, and whether it's fully fit for purpose, whether we should have moved on.
The data we have is only as accurate as the people who input it, and I think there has to be something around the whole quid pro quo nature of, you're giving us this information and this is what we're doing with it, this is the benefit if you've given it us, and very few people realise that SWDS allows them to then benefit from funding for training. And it's seen very much as an arduous task, when actually it can be used to replace a number of data avenues within our organisations already. And it's already there, and it's there for us to use. I think people who provide the care, as much as this is a huge task for us to do, and it did take up a lot of time when I was a provider, we need to be able to communicate to them that actually your commitment to accuracy of data input is changing the landscape of care. You are the people who have got the ability to go, boom, this is what's actually happening, and it's going to go to all of your data streams, and then people are going to have to read it, and that's going to directly change care. I just don't think we've nailed that narrative. I don't think we've nailed that empowerment.
Legislation which allows government to mandate capacity tracker also allows for penalty enforcement action to be taken, and fines to be levied if people don't complete it. Just to clarify, that's not happening right now, but there is a mechanism there. And Daniel and I went to the States in October, and they have a very different attitude to data collection there. I mean, I'm not advocating for their funding model for most of how they do care, but the care providers we spoke to over there and the software suppliers is, in order to provide data back to their local, state level government or federal government, care providers get paid for providing that data. So they get paid for providing data on falls reduction, for example, or on the way that people are being rehabbed. So it's a very different model in terms of how that data is being collected. I don't know enough about it. I want to do some research into sort of what that means in terms of data accuracy, but I just think that's sort of more of a, you're providing us with something we need, so you would therefore get a benefit from it, as opposed to the more sort of enforcement penalisation approach. Is a very different way that they're taking it. ALDI is a research project which is being run by University College London, the Outstanding Society and Care England. And it started during COVID, and what they were doing was matching information about care home outbreaks to NHS numbers to do actual research into some of the benefits around, say, mask wearing, if that actually helps care home residents and helps stop the spread or not. They're now moving into sort of a longer term research plans, which is really care provider led. So that's why the Alzheimer's Society are there, that's why Care England are involved. To do more research on, at the moment, just care home residents are not expanding yet to home care, but we talk a lot about how we don't have good research in the sector that we can be using as a sector to inform sort of national decision making and policy. And Vivaldi is trying to change that by keeping it in the hands of the sector.
Capacity tracker being imposed on the sector, not being designed for it, and its focus on meeting on the care sector meeting NHS targets is very dangerous, because I think we do focus on the quality of life of the individual. How can we look at the outcomes for the individual when we have to be so focused on feeding information to a almost binary system? We have to develop the richness for the data around the person and their quality of life, their life journey, to take it, because we're under such straitened resource times at the moment that people have diminished the richness of data that they're collecting as well.